Welcome back, everyone. With the weather heating up, now is the time to wear shorts and skirts. But if unsightly leg veins are preventing you from doing that, there is help. More than 40% of women suffer from abnormal leg veins by the time they're in their 50s. Vascular surgeon Dr. Edward Mackay is here to tell us about treatments that are available. And I don't think they have to be painful, right, these treatments?
Well, there's some pain involved in them, but it's fairly minimal. The very small needles, or if you use lasers, not much pain at all.
Now, I'm thinking varicose veins, not only kind of unsightly, but can they be a little dangerous as well?
Well, there's a lot of issues that come with varicose veins. It is a problem with the circulation, and it can cause leg swelling, ulcerations in the legs, which are very difficult to heal, and they also increase the propensity for blood clots.
And can it be quite painful as well?
Oh, yeah. The patients complain a great deal of fatigue and heaviness and pain in their legs.
Is there anything we can do to prevent this from happening, or is it just sort of inevitable for a lot of people?
Well, the genetics play the biggest role, so there is some inevitability. But wearing support stockings and support hose, and for men, support socks.
By crossing my legs, am I putting myself at risk here?
Well, that not a major risk. That's been looked at with several studies, and it hasn't really clearly been shown to be a major risk factor.
Okay. Good. All right. We have some before and afters to show, and we're going to take a look now at the monitor here on the left. Is that a varicose vein?
Those are varicose veins. They're larger. They bulge out. They're associated with swelling of the leg, and yes, those are clearly varicose veins.
And on the right, we see the after. How many treatments would it take to get that kind of result?
Well, probably there's one major treatment involved, and then after that, there's maybe what we consider touch-up treatments. But one major treatment where you close off the vein that's really causing it, because usually it's one vein, maybe two, that are causing the backwards flow that makes the veins bulge.
I've heard of something called stripping a vein. Does that still take place?
It probably does somewhat, but there's new catheter-based treatments that are much less invasive, done in the office under local anesthesia. That is a lot easier on the patient. That has largely replaced the standard ligation and stripping. But on very large veins, we still do removal of some veins. We call it phlebectomy. It's not quite the same as a stripping, and it's still just done in the office, local anesthesia. But but not quite the same as a stripping. Okay,
we have another one to take a look at now, and you can tell us what the condition was and what the treatment was.
Well, this is somebody with pretty much standard spider veins, and usually you treat these with sclerotherapy, which is injection of a chemical into the vein. You can use cutaneous lasers, but here in Florida, I find that's you have to be very careful with those because of tan skin. You can you can get blisters and burn the skin.
Oh.
But sclerotherapy works very well, and is probably the standard of care for that problem.
How many injections would we be talking for?
A lot of injections for somebody like that with a lot of spider veins.
Probably done over a long period of time?
Yeah, you probably usually get about 4 treatments is sort of the average for somebody with a significant number of veins like that, and usually spread them several weeks apart, and they can kind of look a little worse initially as they're closing down, and then your body has to absorb them. So probably, I think those pictures were 6 months apart.
Okay, and then after the treatment, which is done, just in the office, you can walk around and just live as usual?
Yeah, walking's the best thing for your veins as far as just health. It lowers the pressure in your veins. It's our sedentary lifestyle that's bad for the veins, the standing and sitting for long periods of time.
Keep moving.
So keep moving.
We have one more to take a look at, and this one took a couple of different stages here.
I like to show this one because it does show how it does look a little, it doesn't really look worse, but you can see how the veins can turn dark and actually look somewhat worse in the midst of treatment. So patients frequently are worried when they see that. Of course, she had fairly extensive spider veins, and then after they heal, it takes a while between that before they completely heal, and they look much better.
The legs look absolutely fantastic, so there is definitely hope, and it doesn't have to be a major operation. It's just going to take some time. Most
everything now is done in the office, and with local anesthesia, maybe a little sedation to help out, but most everything can be done, and you're up walking immediately.
Wonderful. Well, Dr. Mackay, thank you very much for coming in and talking to us about that today, and you can go to daytimeonline.tv for more information. We'll be right back.